In 2011, the first of the baby boom generation started to turn 65. In coming years, the population of seniors is expected to explode. Yet the state and the nation seem ill-equipped to handle the needs of the growing, aging population. The situation is approaching a crisis level because many elderly are already living in poverty, defined as an income of $10,400 a year for a single person and just over $13,000 for a married couple.
91-year-old Cora Shaw is living in poverty despite being a successful trailblazer. In 1949, she was one of the first black persons hired by American Airlines in Tulsa.
The water fountain had a sign on it that says whites only. They took it off the week before I started to work.
She worked for American 27 years.
Did you end up making a pretty good salary?
Oh, yes, I did. I made a good salary. And my husband worked out there as well.
Cora and her husband were able to buy this house and over the years furnished it beautifully. With pensions from American, they were both sitting pretty for retirement. Then her husband got cancer. Cora took her retirement money in a lump sum to help care for him. In the years after he died, the money ran out. Cora was okay on Social Security until she opened her mail a couple of years ago.
At that time, I had insurance with American Airlines, you know, all the employees did. And I woke up one morning and I was getting a letter telling me that the insurance had been dropped. They just cut all of the retirees out.
After picking up her prescriptions at the drugstore, Cora knew she was in financial trouble.
These are all one prescription cost of Lyrica cost $246, 1 month supply.
78-year-old Bonnie Johnson's Social Security check doesn't cover her expenses either.
Not whenever I pay for 3 months supply of my insulin. It's $730 some.
And as costs for things climb, gas, milk, heat, etc., you know, these seniors, while today aren't maybe considered impoverished, next year, maybe even next month, will dip below that line. So
Lance Robertson is the Director of Aging Services for the Department of Human Services. He says 10.5% of Oklahoma seniors are living in poverty, but that rate climbs to 16% when you count out-of-pocket medical and prescription drug costs.
We are way behind this deal, and we have got to get caught up, and we have to do some pretty significant things soon, or, you know, we're looking at the potential of an implosion.
Robertson's agency serves over 400,000 seniors through programs like Senior Nutrition, which serves meals each day to older Oklahomans who are barely getting by. The nutrition program also delivers meals to homebound seniors like Bonnie.
Having a well-balanced meal really goes a long way to improve seniors' lives. You know, the good nutrition is really an important part of staying healthy. And our goal is for seniors to stay independent in their own home, just like Bonnie's doing.
Even though Bonnie gets a state pension check and Social Security, health costs are eating up most of the money.
You know, it's hard getting old, isn't it?
You know, they say it's golden years. I haven't found the gold yet.
It's not uncommon to see people living on $500 or $600 a month. That's pretty hard to do.
I'm going to enjoy all this.
The state's Advantage program keeps seniors like Cora living independently. Tamara Zilar is Cora's caseworker.
Monthly monitoring, making sure all of her needs are met, checking on the service plan to make sure that she's comfortable. Again, whatever needs that may be going unmet.
All the senior programs administered by the state are in dire need of more federal and state funding.
Every program I mentioned earlier, all 17 are grossly underfunded, demands through the roof. You could pick a program, they all look pretty much the same when it comes to budget and demand. Demand is outstripping and outpacing the budget we have by far.
To help, Robertson would like to see local government start directing money to seniors.
I don't know if we're doing enough, quickly enough, to head off what I think is going to be a pretty significant crisis.
Many seniors do not have family members to help them. Sometimes their only contact is with volunteers who deliver hot meals.
Meals on Wheels.
91-year-old Lowell Marsh has children, but now they too are seniors.
And my daughter's husband is at Claremore at Veterans Hospital with Alzheimer, very, very bad.
Hetty Treat and her husband are both 81. They get help from their son Don. He's done a lot of repair work on their home.
So I'm gonna take these shower doors out. I'm gonna put that new kit in here where she can actually sit in there and take a bath. See, that means something to me, for her to be able to sit in there and take a bath, you know?
His mother raised 6 children and worked full-time, as did her husband. Their combined Social Security checks amount to around $1,200.
How hard is it for you to make ends meet?
Well, it's not easy. You don't have much spending money left.
To be honest, I just believe they deserve better. Yeah. I mean, they deserve better. They worked hard, they paid their taxes, they're good people.
A lot more will face rough times as the number of baby boomers advance into their old age. It's estimated 24% of Oklahoma's population will be seniors by the year 2030.
It keeps me awake at night. It's scary to think what statistics we are aware of probably fall short of the reality that's out there.
Our small business owners, our innovators.
Governor Mary Fallon's budget proposal injects an additional $50 million into DHS, but that money is targeted to fulfill the Pinnacle Plan, which overhauls the child welfare system.
And I just have to have faith that our agency director, as well as legislators and the governor, recognize that while important, the Pinnacle Plan cannot be the only thing we put energy and resources and funding into.